any of that.
Okay.
And I don't really want to know.
Oh, there we go. We're all in. Okay.
Yay.
Hi, Anand.
Hi.
Okay.
Well, I'm sure that was a trip.
That was miserable, but we're in. So
right.
Thank you, Margaret. I'll let you go. Sorry to interrupt dinner, but when we're done with this one, I'll just turn this one off. We'll end before 7, and then that way Saoirse can start. She
Yep.
could.
Saoirse to start it. Do I need to do that? I asked Anand if he would make sure that it got recorded and it got posted. When I've asked other people, it doesn't always get posted, and it needs to get posted to our Facebook page. He has never, not once, got it up there.
Okay, well.
So I'm tired.
I'll make sure it happens. Don't worry about it.
Don't fool me once.
Okay, no, well, he's saying he'll make sure and get it up but what I'm asking is then for the next meeting, I'm saying I can't be involved in it. I just we're going to shut this one down, and then Saoirse can start the board meeting. Is that correct? Well, who is starting the board meeting then?
Take care of making sure that it got started, recorded, and that the auto transcript was on.
Okay, so Anand, that's you apparently for the board meeting.
I can't start the thing because as you can see, I didn't get on.
Okay, so Margaret, can you ask Saoirse to start it and record it? Because Anand was having trouble, and that's why.
I can record it. I just can't start it.
Okay.
And make sure it gets posted. That's what I need to make sure.
Yes, that's what Anand will do, but Saoirse needs to start it then.
Right now.
Perfect. Okay, thank you. I'm gonna hop. All right, I'm gonna hop off, and Anand and Steve. Okay, you too. Bye. Oh, God.
Sorry about that.
That's okay. Hi, everybody.
Hi. So the note taker Fathom, it looks like another participant, and you just have to let it on. And if you want, whoever starts the meeting, if they let Fathom on, it will simply automatically do everything.
Right. Okay. Yeah, I don't start meetings anymore because I'm on all these. Yeah. Anyway, the OHA. I'm in a UH or OHA government Zoom thing, and so I couldn't get on, and she didn't know how, and we kept just anyway. Yep. Hi, everyone.
Hi. Well, something must have happened because a few months ago I used to be able to start the meetings, and now I can't do that. So right. I don't know what happened, but we won't go into that right now since we have much less time than we thought we were going to have. Let's go ahead and I'm sorry. Go ahead, Dora-Andra.
Oh, I'm just gonna put the new password in the maybe just this password issue. Do you have that? Because
hold on.
I think it was
being covered up by other things I have on my screen.
Okay.
Oh, save WCC 23.
Yeah.
I got it.
I mean, Stephen can know, but
I got it.
Anyway,
you just need somebody who can fathom the technology.
Yeah.
I've never needed a password to get into the Whiteaker Zoom meetings.
Because you're joining, but to start them, it's like, wow, that was hard.
Yeah.
Okay.
So you only need the password if you're in charge of the meeting.
Right.
I think that's the case, yes.
Yeah.
Yeah. Okay.
I think that's the case.
Give me just a second. I'm sticking it in a document
for
myself for later.
Okay.
Okay. There's that. That should take care of it. Okay. Hopefully we will never have this trouble again.
All right. Perfect.
You've not heard the word hubris before, huh?
Oh yeah. Oh yeah. It's a great word. My sister tried to explain to me it doesn't mean exactly what I thought it meant, but we won't go into her. She's a doctor in musicology, and she tends to lord it over me quite a bit. But that's neither here nor there. So, a couple of things. We got the both of you, and both of you have things to say. If I might ask Dora-Andra first, are you happy with the new contract?
Yeah, it's fine. Yeah.
Okay, just want to make sure because they're going to be talking about it during the board meeting, and so I thought this was a good time to kind of figure out if there's anything that you thought could use some updating.
Well, I mean, I wrote it.
Oh,
Based
okay, that's great. I didn't know. So,
yeah,
so
yeah.
great. Okay, so if you wrote it, I'm sure you're happy with it.
The only thing I have to kind of make clear to the board is that it's a long, laborious story, but getting the grant specifics from OHA have been really hard. I don't understand why, but so all we have is like that huge second paragraph of just all this other grant topics, and 90% of that does not pertain to the topic that we're on. It's a broader public health equity modernization grant language. And so our section is just this tiny little line in there, but because that's the proper wordage of the grant, I included it. And I have to make the board understand tonight that I cannot do communicational disease prevention and tobacco prevention and all the other things that it says in there.
Right.
Unless I clone myself.
Could part of the problem be the fact that in Salem, they're now in the special session that's going to free up the various budget topics? I suspect there's a lot of departments that kind of been stuck waiting for the budget to get passed.
That's true.
Yeah, exactly.
That's what we've been hearing a lot from in our grant cohort meetings, is that everything is just stuck, but that's good to know they're all working again. So
True.
Yeah.
Okay. So finishing off the old grant, or is everything okay with you with that?
Yes.
Okay.
That was a huge push. My goodness.
I'm sure. Are you sleeping now?
I am. Yeah.
Okay. Good. Especially with the weather such as it is, you need rest. This heat will kind of mess people up with that.
It is messing me, but yeah.
Did Drew help with that?
Well, yeah, I mean, to close a grant, there's all these different parts. And so having an actual participating bookkeeper in the room with me was amazing, because, like a lot of forensic work had to be done to go back to 21 from before Drew and I were even here. That grant biennium was so huge. And so it took me about a month to get all the narrative reports done and the activity, and then Drew and I kind of did this whole forensic search to see if we were missing things like expenditures, because things were a little chaotic. So yes, he did. He's amazing. We basically spent an entire day at my house just like poring over the whole thing, and we're both kind of holding our breath because out of the 79 cohorts in the public health modernization grant, we're at the bottom alphabetically, and so no
of
news
course.
is good news, but I keep like, well, it's might not be to W yet. So hopefully we'll get some final word on it, but yeah, it felt really good to just close that all up. And yeah, I did kind of I wrote a sheet up of everything we did with that grant. I wanted to share that with you guys. It's pretty impressive. Cool. It's got a couple other things in it, the CDC grant and everything, but this was great to just kind of encapsulate it all into one sheet. A little pithy, but those were like the main things we did in those. Come here, Rupert. Shh. I let him go outside for a little bit today, and he was like, "I'm gonna die."
Well, I got to tell you, there may be some truth to that, because there we go. I was reading something in Psychology Today about the psychological effects of the heat on people, and they're saying when it's this hot, when it's in the hundreds, your hypothalamus starts activating after only 15 minutes. And even being in air conditioning doesn't really change that. So although your body will be cooler, there are some mental processes that are going to change for the rest of the day, just being out for as little as 15 minutes. So the point here is, if you don't have to go out in that shit, don't do it.
Yeah.
You know, really take it seriously. A lot of people think, oh well, if I'm out there for a while, I'll be fine. No, no, won't.
I've
The
noticed.
bigger issue has been the AQI, which was over 400 for passing.
Right, that was horrible too. It was in the hazardous zone for over 3 hours yesterday, at least in the middle of town, and then it went down from hazardous to just very unhealthy. So hey, that was a great improvement.
Yeah, since I have COPD and asthma, I have to watch out.
Oh yeah, I'm so sorry. Stephen, do you have an air filtration thing in your house?
I do. Yeah, I have a heat pump with filters, and we also
holy crap.
have.
I see that.
We also have room filters, and
good.
We change the filter every time red light goes on.
Good. Yeah.
This was yesterday. This was yesterday in the Whiteaker at 10:04 in the morning.
Yeah.
Oh, that's fucked up. I'm sorry.
Yeah, that was.
But it's still, it is. That's bad.
Yeah. It was
so
really
yes,
bad.
it's so high they don't even have a scale for that one. I'm surprised they even had numbers.
Yeah, I know. It's big.
So, but yeah, it looks people have been posting how to make your own air purification things. Some are on the Whiteaker site. I found another one that was good. A lot of people are just putting the MERV, that's an acronym, obviously, MERV 13 filters on the box fans, and that's okay. A better method is getting 4 of them and putting them, making kind of a cage of them, putting the fan on top. And the reason that's better is because there's a whole lot less back pressure. You can filter more, and it doesn't make the fan motor so hot. So you can actually get a lot more done if you make that. You just like you can either have the fan facing forward and go around it that way and have one in front, or alternatively, some people have a kind of a cardboard cover on the bottom and have the filters up on all 4 sides and have the fan on top of it. But if you've got the ability to do so, that's a much more efficient way to do it. But you know, having one of those filters on a box fan is a lot better than nothing at all.
I attended the Beyond Toxics workshop on it, on the symptoms of various types of heat exposure and how to recognize the differences, and also how to fabricate the simple box fan with a filter duct tape to it. And they were free for all the participants, and they gave free food, so they got very good attendance for people who really needed help with this stuff. There were very few people like me with the luxury of having heat pumps and existing filtration stuff. But I donated, and they paid people $30 honorarium for coming to attend.
Oh wow! Jeez.
I donated my $30, but
Beyond Toxics did this.
Yeah, it was over at that community center over by Amazon Park.
Yeah, I know the one.
Yeah,
I think it's called.
It was really good, really well attended, and the demographics were exactly what they needed to be.
That's great. That's encouraging.
Good. Yeah, really good.
So,
they do good stuff beyond.
Yes, they do. Doriandra, do you have anything else that you want to talk about before we have the board meeting later? Because if there's anything else I can do to help, just let me know.
Sure. Well, I was just wondering if you'd speak more a little bit about, you said that hypothalamus changes with heat. How does it change? I mean, what happens to it? Because
well, it changes a variety of things. So it changes the way your body starts dealing with heat. Obviously, that's one of the most important things it can do. But the other thing is it can also, people tend to get more depressed. They, not directly related to that, I don't think, but it could be. There have been studies about how much productivity people get with the temperatures it goes up. At 90 degrees, it goes down by 30%. At 100 degrees, it goes down by 70%. And chances are that's probably at least partly a brain issue, as well as, you know, the rest of the body. I mean, the brain is part of the body, but in terms of the quick effects of the hypothalamus, and the effect of heat on that. The article was in Psychology Today, so they were mainly looking at it in terms of how it affected mental health.
Yeah.
That was their focus, and they were saying that even 15 minutes of exposure for this is going to negatively affect your mental health for the rest of the day, even if you get inside.
Wow. Yeah.
So it's a concern.
Yeah, it totally affects my productivity, and also it seems to make me extremely anxious. Like I'm just kind of like walking around, like trying to figure out what's wrong, because
Yeah.
even inside, it's really weird.
I'm not going to say anything about where this happened, but let's just say I had a little discussion about how people were feeling about the heat and the smoke yesterday when I was in a group of my peers. And I'll leave it at that. And there was a whole bunch of them were going like, we don't like this one little bit. It makes us people were like having flashbacks from both COVID stuff and previous smoke stuff. And they're just going like, I don't like this.
Yeah.
So, and it was a lot more than just the initial impact. It was obviously because of previous stress. I'm not going to say definitely PTSD because I can't diagnose, but it's probably in that kind of range.
There you go. Yeah, good point. Okay, thank you. Yeah, that's good. Okay, so yeah, moving on to our new project.
Right.
It's kind of a big ball of wax, and it was amazing to see you in person, Stephen. That was so great to kind of bat some ideas around and connect at Oakshire there. There was some real neat ideas that came out of some of that conversation. Drew was bringing up, like food preservation ideas and classes that we could kind of generate, once we get the basics in place of what that looks like, long-term self-reliance. So yeah, I have a big plan tonight to present to the board, and Drew will present the budget that we whipped together. And then, with this grant, both the work plan and a budget, it's important to remember that those are moving targets. Like the OHA does not hold us to the mat and say, this is, what you say you have to do. And, as I learned when kind of, as we were all think tanking the housing is healthcare, so many things change once we start doing the research and looking at the infrastructure and stuff. So I'm acknowledging that this will be a malleable process as we go. And what you thinking, Stephen?
I'd like to add to the previous suggestion where I suggested that we get what we need to communicate to Eugene Emergency Center.
Yes.
And to prepare our own node here in the Whiteaker. The other thing that I think probably needs some budget, possible inclusion in budget, is help with people prepare their go bags, because part of preparedness is having a go bag, and there's stuff that's recommended to have in that. And some people may have financial constraints on putting in a go bag together. So that's another thing to look at. And as far as communicating with existing disaster response mechanisms that are already established in the city, make sure that what we have is current, because there's stuff, the document I sent to you guys was like a couple of years old, and I don't know whether that's the most recent one. And make sure that we are splicing what we do into existing stuff. Otherwise, we will find ourselves reinventing several wheels.
Yeah. Okay. What did you what were the units that you suggested we add? What are they called again for communication?
They're called Citizens Radio Network. Family Radio Network, FRN, I think that's what, or FRC, Family Radio Communication Sets. It's basically walkie-talkies, but that's the fancy name for them. There's lots of different ones. And there's the document that I sent has the various frequencies for communicating, and it would then allow us to link to the city's emergency management through the ham radio network. The way it works, there's a central emergency center. Then there's ham radios bringing in information from local areas where the local areas may not be able to communicate directly with central command, as it were. And they are also used for once we figure out what we need to do or figure out what's going on, we would send people out like in pairs with a set of radios to patrol the area and see what immediate help is needed and where the biggest needs are and stuff like that. The Know Your Neighbor program that Megan Kemple coordinated in the area has you prepare a map of your part of the neighborhood with the people in there. You mark on there any gas that needs gas shut-off valves if they're in the area. Anybody that has special needs for mobility in your area. And it also, besides getting to know people, it also has it provides the smallest organizing unit within the preparedness network. So our zone, I think it was zone 2, I think, whatever the zone was, 22, or whatever the zone was of our zone. There's a map in that document I sent out, tells you what our zone is, and it's like a hierarchy of organization. But the fundamental thing is we need to be prepared for like a week or two with really no help coming, and that's fundamental to our preparation.
Exactly. Okay. Yeah, excellent. I think, I think the biggest thing that I'd like to start with, and a side note, I've put a lot of money into the supplies part of the budget that we'll all look at tonight. So I think that's where we can get these FRCs purchased. But I've made a form for our local businesses that here, I'll show you guys this because I'm thinking, yesterday was an interesting kind of snapshot of how this could go down, where we, there's not exactly a convenient place for people to go to in the Whiteaker. They could go to their, the cooling stations at Lane Event Center, and we had a couple other things. I talked to the folks at the Campbell Senior Center, and she said, well, we only really have room for 8 or 9 people in the lobby, right? So I feel like the Whiteaker is missing a quick infrastructure of where people can literally just walk to quickly in the event of something. So I want to start with this survey. Let me share it with you guys.
Gee, wouldn't it be nice if we had a community center?
Yeah, it sure would.
We, in the Know Your Neighbor, you identify a muster point for that part of your neighborhood. And the Emerald Village folks that we could gather, our part of the neighborhood could gather there. It doesn't accommodate the young people living in, or the people in the apartment buildings. It's really just the single family homes between pretty much us and a couple of houses north up to Railroad. So it's not a big organizing unit, but we did include the Emerald Village in that effort, and that was
that's good.
That was before the pandemic, so we need a follow up at some point.
Right. Well, did you see is the form opening up? I put in the chat there for you guys. I got it. Okay, that's kind of where I want to start and send that to everybody that has a business in the Whiteaker, and because I feel like it's going to be about gathering data and what people can do. Can Nkasi shelter people in place in the Better Living?
Good.
Can Bruns hand out perfunctory basic food and water from their stock? can say, for instance, do we have businesses that have backup solar power?
That is a wonderful start form. That's great. I love that.
Thank you. Thank you. Yeah, it seems like if we can co-locate what our businesses can do, then I'll take all the information from this form and get it into a big spreadsheet. And then from there, we have a base of resourcing. And then, in tandem with this, I feel like the council and all the folks in the committees, like Stephen and other people involved, I should make a form for us, like who among us can do this? Who's got CPR cert training, who can open their house, who can blah, blah, blah. And I just think it's a lot of kind of like data gathering right now for the next week or two or three. And then from there, once we have that, I did reach out to Megan. Thank you so much, Stephen, for her email. And we chatted about it. And she's totally willing to kind of get involved and relaunch the Your Neighborhood program based on the information that we get from businesses and then people that are willing to step up. Because if we look at this kind of in a model of that, the Whiteaker is probably never going to have a very focused ICM place or an incident, control management center. I talked to Cheryl, and Cheryl's really interested at the Eugene mission, but I mean, they have their limitations too. They had their air conditioning go out, and so everybody was in the chapel, So, sorry, I'm rambling, but I figure we just need to be gathering as much data as we can, and then next month we can just say, okay, here's what we're going to do. And because I mean, in a perfect world, that would be so ideal. Like the Whiteaker is trained. If you need this, you walk to Ninkasi. If you need that, you walk to here. You go to Nelson's. You go to Oakshire, whatever. And if we could just co-locate like 3 or 4 big businesses that can offer certain things, and then we train people to know that that's where you go. It's a huge start because it keeps us, it keeps people from not accessing needs. I mean, everybody can walk to Bruns, everybody can walk to Nelson's, or but they can't in an emergency walk all the way to Lane Event Center.
Right.
So
do take a look at the end of that document I sent out, because there are a lot of suggested forms at the end of that.
Okay. Yes.
The way those forms are designed to plug into the kind of reports that the state will need when neighborhoods are doing reports about what happened during and how did the response go, so that things can be refined and improved next time. So that is part of the plugging into existing systems, the forms at the end of that document.
Good. Yeah. It's funny because I'm actually a cert trained person. And so I went through my massive thing today, just like, oh my God, there's so much. And one of the things too, it was real interesting. I'm also trained in the Red Cross facility or shelter opening procedures, like how to quickly open a thing. And I was like reading through this again today, and it is so laborious. I mean, it brings up so many issues about how you really provide shelter. And the incredible, like yesterday, Margaret was so excited. She's like, Doriandra, figure out where we could open something. And I said, whoa, it's not like that. We need liability. We need trained staff. We need, conflict resolution. We need, if you go through these things, oh my God, are fire extinguishers and smoke detectors? Is there, on and on and on. And so I don't think without us having our own building that we control, or, I think unfortunately, like things that we need may be scattered around the Whiteaker because certain people can only do 1 or 2 things, but that's better than just not.
Well, the businesses are a resource. I like the way you're looking at them as a resource rather than as a completely separate entity. And as far as having our own place for the Whiteaker, we got, what's the population of Whiteaker? It's 3,000, several thousand, right? So none of no one building is going to fulfill that need. It's got to be broken down by sub neighborhoods.
Yeah, exactly. Yeah, exactly.
Each with their muster point.
Right. I love that term, muster point. Yeah, like we're on a ship. So great.
Yeah, or we're outside a lab that has toxic materials, and they can have a release of something they need to muster. And there's windsocks on the building across the road from us, or
That's
a
right.
windsock. So when they evacuate the building, they make sure they're not mustering in a point downwind of their own facility.
Interesting. Right.
Well, we've got the train, and you never know what sort of toxic stuff is running through there. That's
Yeah.
the definite. I mean, if we have something running through us and we get an earthquake,
Oh my God.
yeah, could be an issue. Time is moving on. Is there anything else that we should talk about before the board meeting, Doriandra? Because if there isn't, I would like to get Stephen to have a chance to say a couple things. So I sent you some information, and I wasn't in any fashion meaning that you should change anything based on that, but it was just information on methods of dealing with trauma that I had gathered from other reputable sources. But I am curious as to what more you're doing with that document and where we want to proceed from there.
One I sent out to you a few days ago incorporated all the material you sent to me.
I'll have to, I'm sorry, due to the weather and all that, I haven't really been looking at my email that much. I will go back and look at it. Thank you.
And
I will find it.
all I need by email is just your okay that it incorporates stuff correctly. The only thing I will change the formatting of the links to the Lane County and City of Eugene resources that you provided, so that they fit across one line without doing line break to the next line. Line break on a URL pisses me off, and that's what
Right.
happens.
Well, it makes it difficult for people to use because it's hard to write that.
Yeah.
So
And it will also probably get it down to 3 pages. And then if you're both okay with it, just other than final formatting, would you like me to send it out to you again?
Sure.
If you want to, that's fine.
Okay.
If you're feeling up to it.
Since
I'll resend the doc after this meeting. I won't send
That's
it
great.
now.
Perfect. Thank you. Yeah.
If neither of you has anything to add other than I'm going to clean up the formatting, let me know, and then we can decide how we're going to transmit it to the board at some point. Probably not tonight.
Very good. No, probably not tonight.
No. Okay.
Yeah. Everybody's having a tough time. So that's great. I feel good about things. Anything anybody else want to say before we close things out? We said we'd end things a little early so that it'd be easier for them to get the board meeting started.
Yeah.
You got anything else, Stephen?
This is great. It really feels like we're involved with the guts of neighborhood organizing here.
Don't tell anybody. Okay.
The real stuff.
I'm super excited to work with you both on this. I just feel like it's a really great new project. So I just,
Cool.
in closing, I hope that maybe we could even meet an extra time before, or just help me guys, because I feel a little bit overwhelmed, and like what Anand was saying, like what about the train, and I could use some help, like really identifying where we should what crises we should target the most, and that's always folly, because then the ones that we don't focus on happen. So
exactly.
The thing that you're concerned about, the things that you're concerned about going wrong always distract your attention from what actually does go wrong.
Right.
That was Miguel's law that I formulated when I worked in South America. You're trying to do contingency planning, but it never works, because you have a contingency plan for everything except what actually happens.
So true. So yeah, maybe we can just I'm working on it. I've got 20 hours a week to work on it, and I expect to hear from me a lot, because it's a lot to think about, and I want to do it well. So glad you guys are
Well,
there.
we could think of it as the umbrella theorem. You carry an umbrella and it doesn't rain. You get all these contingency plans. Those are the ones you don't have to worry about because they aren't going to happen.
That's right. Okay.
Yeah, I got to bend plate and tectonics to the will of Anand.
That's right.
Insert plasticity into the Earth's crust.
Absolutely.
Yes. Neuroplasticity for everyone. So,
Indeed.
There we go.
Okay. Well, I'm
Good.
glad to see you all doing more or less okay. I'm more or less okay too.
yeah,
Everybody at my place is doing all right.
Okay.
It's been a little stressful, but it's been okay. I made a point. I own the duplex. My son lives on the other side with his wife and his 2 kids, and I got my stepfather in another section, and I got another friend of mine living up in the attic. I made sure they all have air conditioners, they all have air purifiers. It's complicated, but they're going to be okay.
Good. Yeah. Yeah.
So yeah, but with that, if anybody does anybody have anything else to say before we close it down?
We'll see you at the board.
Absolutely.
Thank
See you guys.
you.